Around the world, flexible endoscopes used in millions of medical procedures each year often are not sterilized between patients. Despite rigorous cleaning protocols, studies continue to reveal residual contamination, bacteria, biofilm, and organic matter that standard high-level disinfection cannot always remove. In hospitals everywhere, clinicians rely on these tools to look inside the human body, but if they are not truly sterile, they can introduce infection, putting patients at risk.
The endoscopes have the highest risk of infection of any medical or surgical item in healthcare because it is disinfected and not sterilized. All other critical instruments in healthcare are sterilized. But until recently, we have not had a terminal sterilization procedure for endoscopes because they are heat sensitive with plastics. One of the problems is that the endoscope is very complex. It has very long and narrow lumens. The interior diameter may be 1 millimeter, and we need to eliminate all 10 billion microorganisms associated with that scope. And we know that more than one survive disinfection, and that's why sterilization and terminal sterilization is preferred for patient safety.
For decades, the challenge has been temperature. Traditional methods use high heat, which is effective for metal but destructive to endoscopes.
Endoscopes are used by doctors to look at the cavities inside the body, and inside they have many channels which are very narrow, very long, and channels can even split up into 2 or 3 at a time. This is why when a doctor performs a procedure, sometimes small amounts of fluid or tissue gets trapped in between these channels, and liquid disinfectants or detergents are not able to reach every surface. Therefore, microbes start harboring inside, and these microbes can infect the next patient or patients. So in our case, we needed a different approach. We needed something that was low temperature, but also that was designed specifically to be able to sterilize these very complex, long, multi-channel endoscopes.
Sterility matters, not just as a technical benchmark, but as a cornerstone of patient safety.
We know that there's tens of thousands of infections associated with gastrointestinal endoscopes each year in the United States, and some of those infections may result in death. So the infections occur commonly by various data in the literature, and of course, all those infections are preventable now by sterilization, which may not have been preventable 10, 20, 30 years ago because we were forced to use disinfection.
Driven by the belief that no patient should ever face a preventable infection, Ideate medical scientists and engineers have developed a truly unique breakthrough, a low-temperature sterilization technology that achieves full sterilization of all flexible endoscopes safely, rapidly, and effectively.
Ideate Medical was founded by a team with a very diverse background in healthcare and sterilization and medical devices. And we founded it to be able to solve a long-standing problem. If you think about it, when a patient goes through an endoscopic procedure, everything that's surrounding the patient, the instrumentation, the supplies, the materials, the towels, drapes, gloves, everything is sterile. Yet the one device that's actually in contact or inside the patient, it's only disinfected and it's not sterile. This is why we created Stereoscope, Ideate Medical's sterilization system, and it's based on a proven technology called hydrogen peroxide gas plasma. The gas is able to go into every channel of the endoscope in comparison to liquids. And this is something that traditional methods are still struggling with. With Stereoscope, we are able to sterilize the endoscopes in a fraction of the time compared to traditional methods in about 40 minutes. And this way, we're able to eliminate the most resistant microorganisms that are out there.
By combining precise temperature control with advanced sterilizing agents, Ideate Medical's system penetrates deep into every channel of the endoscopes, ensuring complete microbial elimination, breaking through the limits that once held hospitals back. For clinicians, it means confidence. For patients, it means safety. And for healthcare systems, it means trust.
In the future, we believe that this technology should be available for every hospital. It's very important that doctors and patients are aware of what's out there, and hospitals will be able to increase the standard of care, increase the safety of the patients, and also they will be able to mitigate any risk related to infections.
Empower the patient and family. It is important that you or a family member ask your doctor, has the endoscope you will be using been terminally sterilized, and will it be documented in my chart? Preventing tragedy through innovation and responsibility. To learn more, please visit ideatemedical.com.